Hello and welcome to the September board update film. We didn't have a board meeting in August, so this is an opportunity for me to give you an update from the September board on what was discussed and some of the key points the board are talking about this month. As always at the board meetings, we started with a patient story, and this month our patient story related to a particularly difficult complaint that we'd had within the organisation recently. Helen Ryan, our Director of Nursing, and myself have both recently met with the complainant, who's the wife of a patient, and talked through her concerns of what she'd seen and experienced within the hospital. It was really valuable for both Helen and I to hear that firsthand, and the board were very reassured that we'd listened and acted on the complaint that this particular person had made against the organisation. The board were also really supportive of the new approach we're taking to complaints, which is to really move away from a process which is very bureaucratic and paper-based to much more going out, talking to patients and relatives firsthand, listening to their experiences and learning, most importantly, from that experience, making improvements to the way we run the organisation and the way we deliver care, and making sure that every complainant has the opportunity to understand what changes have been made as a consequence of their complaint. I also took the opportunity to update the board on the work we're doing across South Somerset as part of our Symphony Project. You may have heard the Symphony Project involves ourselves, the hospital, working with the Clinical Commissioning Group, Community Services from the Partnership Trust, Adult Social Care and other partners to really think about how we change the way in which we care for frail, complex elderly patients moving forward, to work in a much more integrated way across our various organisations. This is a really important part of our strategy for the organisation going forward, and I was able to update the board on the progress of our bid to become a national pioneer for integrated care. The government have been asking for people to put themselves forward, and our health community put in a bid to become a pioneer site. There were over 100 applications nationally to become a pioneer, and we've now been shortlisted down to the last 28. So we're hoping to hear at the end of October whether we've been successful. Linked to that, we also had a visit last week from the Health Minister, Norman Lamb, to YDH, which was a really good opportunity for him to come in and meet some of our frontline clinical staff in the emergency department, and to also hear about some of the work we're doing to improve the care for frail elderly patients as part of our Symphony project moving forward. The board also reviewed the clinical quality report this month, which was presented by John Howes, our Medical Director, and Helen Ryan, Director of Nursing. Helen was able to update the board on a number of actions that we're taking in response to the Francis report, which came out earlier this year into the failings at Mid Staffordshire Hospital. There's a lot of work going on across the hospital at the moment, based on the recommendations from Francis, particularly with regard to nurse staffing levels. Helen and her team are looking currently at the nurse staffing ratios we have across the hospital, and we're planning to review that in our management team in the coming weeks. And we will be publishing those staff ward ratios on our wards in the coming months. We're also able to update the board from John on the continued progress we're making to reduce our HSMR, which is the Hospital Standardised Mortality Ratio, which is an indication really of the expected death rates in hospitals, and this is something again that's got a lot of national publicity recently. Our HSMR is really good at the moment and has continued to improve over the past few months, and we're really pleased to see that continued improvement. However, we're not complacent, and we know that we need to continue focusing on improving our patient safety and quality, so we were able to update the board on a number of things that we're doing with that regard as well. John also updated the board on some of the work he's been involved in with the King's Fund, looking at the future of small hospitals, and also a recent report from the Royal College of Physicians on what the future of hospitals will look like. There's a lot of conversations going on nationally about the future of small hospitals, and it's great that we are actually being involved at a national level in a number of these conversations and giving our views and perspectives on what the future models of care need to look like, which very much see hospitals being part of an integrated health and social care system in a local community. We also reviewed this month the performance report, looking at how we're performing against both clinical and operational standards. Pleased to say that overall the performance of the organisation is really good at the moment. We're delivering on all our key objectives and performance standards, including our A&E 4-hour performance, continue to see improvements in our ambulance turnarounds and our RTT waiting times for elective care are also really good. So overall, the board were really pleased to see a good positive performance picture across the organisation. Tim Newman, our Chief Finance Officer, also gave an update on our finances, and again we're performing well on our financial objectives. Our CIP programme, our cost improvement programme, is progressing well, and we're delivering that in line with our expectations. The big challenge we have is that in the second half of the year we have a significant amount to deliver, so we've really got to maintain a continued focus moving forward, and the board want to carry on providing a great deal of scrutiny in the coming months to make sure that we keep our eye on our finances and that we deliver our cost improvement programme in line with our expectations. Also on Wednesday, as well as our board meeting, we had the Trust's annual general meeting, which is the opportunity for us to present our annual report for the year 2012-2013 and the annual quality account. This annual general meeting is open to anybody in the wider community, staff, our Foundation Trust governors and members, and it was great to see people coming along to hear from us about what our achievements had been over the past 12 months. The annual general meeting was an opportunity for John and Helen to present the quality account, highlighting some of the improvements in clinical care that we've made over that period, as well as the areas where we're going to be focusing over the next 12 months. Tim gave an update on the financial performance of last year, and I was also able to give an update to the audience on our key achievements, as well as a focus on moving forward what the key objectives for the organisation were going to be in the next 12 months. We also had two presentations at the annual general meeting which were really informative. Firstly, Jeremy Martin, our project director for the Symphony Project, gave the audience an update on the Symphony Project around our work to integrate care for the local community. And Janine Valentine, our nurse consultant, gave a great presentation around the Trust's approach to dealing with patients with dementia and some of the really exciting work that's going on across the organisation to improve the care that we provide to this most vulnerable group of patients that we see. Hopefully you found this brief summary of what we talked about at the board and the AGM useful. As always, if you've got any feedback on what you've heard, please let me know or contact our communications team. Thanks a lot.